and welcome to Mindfulness Mondays, a special series on mental health and wellness in the territory. I am Dr. Chatel Noel, Director of the Behavioral Health Division at the Department of Health, and your host for the evening. May is Mental Health Awareness Month, and across the country and throughout the territory, conversations are focused on mental wellness and how we get there. This evening's episode is about suicide prevention, and it was spurred by months of interactions with the youth of the Virgin Islands. We wanted to speak on a topic that truly mattered to them, but also to you. Tonight, we will be discussing ways we can open the lines of communication within our territory about emotional pain. Joining me this evening as co-host is Zulima Webster, State Prevention Coordinator with the Behavioral Health Division and a licensed marriage and family therapist. Our first guest for our first segment is none other than Commissioner Justa Tita Encarnacion. Good evening and welcome, ladies.
Good evening.
Good evening and thank you.
Absolutely, happy to have you guys here. Commissioner, recently we have suffered 4 deaths in the territory of Virgin Islanders, 2 locally and 2 on the mainland. What has been your message to the community just discussing the anxiety around these passings?
I think the first thing and the first word to always use is hope, because when we are not exposed as many other jurisdictions in the mainland are to suicide. We have been blessed. We see very sporadic suicide or attempts of suicide within a territory. And so it's also important for individuals who are contemplating, who are thinking about it, whose family members are maybe aware of what's going on, that suicide can also be prevented. But I think that we need to, and that's why I think that behavioral health and what you guys are doing on a day-to-day basis focuses on the prevention aspect of it and the de-escalation of what can actually occur. And my message to you as a community is relationships, family, knowing who you are as an individual and how relationships come together, looking at the community and pulling from your community, as well as us as a society and how we deal with things. And one of the things it's interesting because I know I asked you, I know nationally there is a theme for Mental Health Awareness Month, which this is, as you mentioned. And the theme nationally is different than what we're doing locally. And that is because the stigma of mental illness is a little different here within the territory, or really and truly within the Caribbean. So what do we change and how do we change the stigma? And so making it a different way. So doing things like this, having discussions like this, going to schools, I love that you guys are going into the school system and speaking with children, private, parochial, public school systems, and finding a way to get to the home schools as well. How do we make an impact on them? And I know that there's so many other things that we can discuss with that, but that's one of the things that I would do and say.
Well, the Virgin Islands Department of Health has always been charged with focusing and prioritizing mental health, now behavioral health. Would you share with the community aspects of the new Behavioral Health Act?
Well, the Behavioral Health Act, let me just go, it's 8688, right? We worked very hard with the Governor's Office on the Behavioral Health Act. And I think that the best way to look at the act now is that it's an act that replaces a very old act, but it focuses on collaboration within the community. It focuses on children. It focuses on making assessments and diagnosing. But primarily, if the one word that I can use, it goes back to collaboration. So that is actually varying departments: Department of Education, Department of Human Services, VIPD, Department of Justice, and of course, Department of Health, Behavioral Health Unit, as well as others, because behavioral health is something that actually should be identified all over. I always tell my staff that if we have individuals who and I think that the term that you use when we spoke about is emotional pain.
Yes.
Okay. Individuals suffer emotional pain no matter what if they're coming for at Department of Health. They may be coming because you have postpartum depression, right? They may be coming to see family planning, or they may be coming to see someone in maternal child health or chronic disease, but an emotional pain. It doesn't matter who and where you are. And so what we're doing now is trying to really explain that a little bit more and have people understand it,
Right.
and not be afraid of it.
Absolutely. So one of the collaborations that we have really focused in on, because you've mentioned some key ones, has been Veterans Affairs and the work we're doing with Director Farrell. Can you talk a little bit about that?
Yes, well, SAMHSA and the Veterans Affairs made a call. They wanted us to be able to work on suicide prevention with the veterans. And they spoke with, of course, Shannon O'Reilly, my chief of staff, and I felt that that was important for us to be a part of it, but we couldn't do it without the expert, which is Veterans Affairs. So Director Farrell and I have joined together championing the cause. And so we are part of the Governor's Challenge, looking at the 988 number, but also looking at the data. Unfortunately, the United States Virgin Islands and Puerto Rico, as big as Puerto Rico is, we do not have any data that focus on suicide prevention. And so that's one of the things that we're looking at. What is it that we can do differently? And so ideas, and I think that public's opinion is very important. A lot of the states are doing similar things. And one of the things that Deputy Commissioner Renan Steele and I are talking about now through our email is how do we look at the 988 number and have everyone see it, but understand what it means. So connecting with that. So basically, right now in the territory, what we're doing is we have implemented 988, which is a number very similar to the 911. So if you have emotional pain and you feel like you may hurt yourself in any way, or you feel like you just want to talk to someone, or you know someone that is in emotional pain, you can pick up the phone no matter where you are and call 988. Then that person is someone is going to answer at the end of the line. What we in the Department of Health in the U.S. territory is doing is that we're trying to create an on-site 988 operating system. We're well on our way. We're hiring crisis intervention specialists as well. We have our van ready. We have our drivers ready. We're now ready to hire the operators who are going to be certified trainers so that they too can be able to answer the call, but listen and feel, so that they can empathize, so that they in turn can assist. So that's where we are right now. So we're very close to making that happen. But it is also a different venue, because you can also text or call so that you can speak. And that number, it's 988-lifeline.org, 988-lifeline.org. However, linked to 988, Dr. Chatelle Noel and her staff are always available to assist as well. And so those numbers in St. Croix, 340-774-7700, and that's on St. Thomas, St. Croix, 340-712-0096, and in St. John, 340-776-6400. And you can walk in. The staff is never going to turn you away. We're going to find a means and a way to help you.
Thank you so much, Commissioner. It's always a blessing being in your spirit, being in your presence. And with that, we're going to tell you adieu.
Thank you. But before I go,
sure.
I want to really let the public know that we have an awesome team. Dr. Chatelle Noel is one of us, one of the Virgin Islanders that came back home, and she is from St. Thomas, and she works with us. Zulima as well is from here. She is a Crujan, right, Zulima?
Yes.
And I think it's important for us to realize that bringing back people from away back home to be part of the change is something that I think we should be proud of. Absolutely. And I want to tell you and DC Steele that I am proud of what you are doing, what you're going to do, because there's so much more that we can do. So,
and we couldn't do it without your support. So thank you for that.
My pleasure.
On that note, we're going to go to break and be right back.
We grow food to feed our community and to keep us healthy. Eating a healthy diet is important for good health.
Eating fruits and vegetables makes us go stronger.
Eating healthy is easy. There is an abundance of locally grown produce and livestock you can enjoy.
Your meal shall be colorful with lots of food like spinach, pumpkin, and tomato.
Sliced raw fruits and vegetables make a healthy snack.
Local nuts, beans, lean meats, and fresh eggs are an excellent source of protein.
Limit the amount of sugar and salt you consume, and choose whole grain options when eating pasta, bread, and cereal.
And make sure to get moving every day.
We can all help each other live healthier lifestyles. Support a local farmer today for fresh, local food.
This message was brought to you by the Virgin Islands Department of Health, Division of Chronic Disease Prevention, and the USVI Cancer Coalition.
Welcome back to Mindfulness Mondays. Our topic of this evening is suicide prevention. Culturally, Zulima, I feel like we hide behind our culture and we don't openly speak about suicide, suicide ideation, and that emotional pain that we referenced earlier. How do you think we go about changing that narrative?
I think part of the changing the narrative to me means changing the language, changing history, changing behaviors, some of the customs that we have, steering towards, pushing, being strong, pushing resilience. Those are positive things, but sometimes overused, or maybe even sometimes used in the wrong instances. I feel like changing the narrative also means listening more. The youth are constantly trying to talk to us and tell us how they feel, and sometimes just from our custom, our cultural backgrounds, we're not really as supportive emotionally. We know how to be supportive physically, we know how to be supportive financially, and sometimes what they need is a listening ear. You might not agree with how I feel, but can you listen? Can you hear me? Can you validate my feelings? Those things to me are a big part of changing the narrative. Allowing somebody as an individual to create their own narrative. Because everybody's story is different, everybody's experience is different. So just knowing that, hey, you might feel this way about this, you might be grieving in this way, but I might grieve in a different way, and I might feel, it might take me a longer time to feel sad.
Right. And it seems as though historically, mental illness has been a death sentence, right? So now we know recovery is possible and someone can go on, even when diagnosed, to live a full, healthy life, and you would never know that they had been suffering and have a history of a mental illness, right? So what are some of the things that you see in the school systems when you're going into the schools?
I think when I go into the schools, the kids, honestly, we've been in schools and seen students as young as 5th grade, up till 12th grade. We've even seen a few students at UVI. However, the students are way more aware about mental illness. They speak more freely about mental illness. They're more supportive. They talk about depression. They talk about anxiety. They talk about self-care, different coping skills that they use. Of course, the phone being a big part of the coping mechanisms. But also, a big thing that I see in the schools is the children are not afraid to say the word suicide.
Right. The power of language.
Right. They're super aware.
Right. So let's talk a little bit about signs and symptoms. I know these are conversations that you and I have, and in our field we talk about all the time. So let's talk a little bit about that. When it comes to signs, that's something we definitely want the community to know. Signs are actually what you see in someone else who may be suffering from that emotional pain. So we're looking at things like individuals who are isolating themselves. They're not coming out of their rooms, out of their homes, they're not reporting to their job, having those financial misgivings. So instead of budgeting for things like their rent or their WAPA bill, they are spending money what we would call wildly. They're gambling. There's an uptick in use of substances and of alcohol. That's not really tied to anything else. So we may see those upticks around special occasions like weddings, anniversaries, carnival celebrations. But if it's a regular Tuesday and nothing is going on, the person's not celebrating anything, especially if they're by themselves and you see an increase in use or alcoholism, that's definitely a sign. We want to talk about just talking about death, right? Because we're talking about how our youth openly talk about suicide, but it's in conversation of things that they've seen in social media. I think there's a different conversation to be had if a person is planning their funeral, they're healthy, no death has happened, and they're like 12 years old. Right. So we want the community to know what those signs are, but let's define and talk about symptoms as well. So what would you consider to be symptoms, and what does that look like?
So yeah, a symptom would be like a sign, but felt only by the person. So a symptom wouldn't be something that we can see. Right. Someone would have to report feeling a symptom, and it could be physical or mental. So it could be crying spells, maybe crying to themselves, so you're not aware of it, feeling hopelessness, feeling loneliness, low self-esteem, just even thoughts of suicide, thoughts of death, being overly obsessed with death. Right. So those symptoms would have to be reported. Someone would have to report, this is how I'm feeling, this is what's happening to me, in order for us to be aware, because we can't visibly see a symptom.
Right. And can we talk a little bit about, or can I ask you, symptoms and signs don't necessarily have to be what we're having in conversation, because we've talked about the post on social media. So we're asking the public, if you see someone, whether you are familiar with that person or not, if you see that person posting information such as, I'm tired, I don't want to do this anymore, I feel like giving up, you see that person selling all their belongings and it's not tied to like, I'm moving or I'm relocating, something like that. We do ask that you just reach out and be supportive to that individual, because they may be experiencing those symptoms, and that is the sign, that is the red flag that we're looking for to be the person to reach out and be a safe space. Can we talk also about psychological safety? So what that means to someone when I come to you and I tell you what my symptom is, what does psychological safety look like?
Psychological safety would be more of creating a safe space for that person, allowing them to feel heard, not judged, letting them know this is a judgment-free zone, and giving them the opportunity to express themselves. And also, I feel like HIPAA is a big part of psychological safety as well, letting them know this isn't a space where, I'm going to tell somebody else, or, a situation where this is for gossiping, because that would make somebody feel safer to be able to express what's happening mentally or emotionally.
Right, absolutely. So I wanted to make sure that we touch base with that, because again, we have to think of the cultural lens. As the commissioner mentioned, we changed the theme this year to changing the narrative, which is different than the national theme, because we feel as though the public may not feel comfortable coming to our office. You may think that someone is seeing you, that you feel uncomfortable knowing that you're coming to the Division of Behavioral Health. Please know that we do not go out gossiping about what you've shared with us. Our space is safe at all times. You can come in and discuss whatever you are going through, or even what you're seeing in your friends or family. And if you just need someone to reach out to know what the resources are, we are your safe space. Going back to our youth conversation, we talked about how the youth are open and with discussing how they're feeling and kind of what they're seeing on social media. But I'm wondering if we're doing a good job as well of balancing what we're putting out to the public, but also being mindful to not re-traumatize friends and family members of the individuals who we lost to death by suicide.
And that's a really good point. So I would ask you, what are some encouraging words or appropriate words for encouragement to the ones that have lost?
Right. So I think we have to start by, like you said, not immediately going to react. I think by nature we want to fix, right? We want to stop that emotional pain. But by not letting that person feel that emotional pain, we're actually stunting their healing. And many people don't realize that. So instead of focusing on trying to fix the wound, sometimes you have to leave the wound get some air. Just like a physical wound, sometimes you have to let it get some air instead of bandaging it up, because you're actually doing more damage. Right. I tend to use an analogy that just because I can't help you find the light switch to brighten up the room doesn't mean I can't sit with you in the dark. And I think it's really important for individuals to know that I'm here with you. I may not feel what you're feeling, but I support you. When it comes to actually what you can say, make sure that the family knows that you're not there for judgment. So like, again, that's psychological safety, right? You don't have to be a professional to exercise psychological safety. And letting them know that it's okay to struggle with the why. Something that we haven't touched earlier was when someone dies by suicide, we are left with the why question. Why did this person do this? How did I not see the signs? And there's a lot of blame, guilt, and judgment that even if the public doesn't put on us, we put on ourselves. So I would encourage anyone who does not know what to say, just show up and be present. I think that's really, really important to the individuals going through that loss.
That is extremely important. So how do we help?
So in addition to being there, I think the commissioner hit the nail on the head of the 988 text and chat line, knowing what the resources are. So I'm going to repeat the numbers so that everyone has those. In St. Thomas, 774-7700. In St. Croix, 712-0096. And in St. John, 776-6400. We're going to go to break and we will be right back.
We grow food to feed our community and to keep us healthy. Eating a healthy diet is important for good health.
Eating fruits and vegetables makes us go stronger.
Eating healthy is easy. There is an abundance of locally grown produce and livestock you can enjoy.
Your meal shall be colorful with lots of food like spinach, pumpkin, and tomato.
Sliced raw fruits and vegetables make a healthy snack.
Local nuts, beans, lean meats, and fresh eggs are an excellent source of protein.
Limit the amount of sugar and salt you consume and choose whole grain options when eating pasta, bread, and cereal.
And make sure to get moving every day.
We can all help each other live healthier lifestyles. Support a local farmer today for fresh, local food.
This message was brought to you by the Virgin Islands Department of Health, Division of Chronic Disease Prevention, and the USVI Cancer Coalition.
Thank you for joining us for our very first episode of Mindfulness Mondays. And many thanks to Commissioner Encarnacion and Deputy Commissioner Renan Steele, who lead the behavioral health team for ensuring the department continues to meet our behavioral health mandates. We want you to know that mental health is not a destination, it is a process. No one else can heal or do your inner work for you, but you also do not have to do it alone. In 2023, we are changing the narrative. We'll see you next Monday, same time, same place, for another episode of Mindfulness Mondays. Before we close, please enjoy this Mindfulness Minute grounding exercise with Amanda Armstrong, yoga instructor.
Hello, my name is Amanda Armstrong, also known as Yogi Mandi. I will be guiding you today through a short meditation. Take a second to get comfortable. Allow your body to relax. In this moment is meant for you to observe and be present with yourself. So I welcome you to close your eyes and place your left hand on your heart and your right hand on your belly. Let's take a deep inhale through the nose and then open up the mouth, exhale everything out. Beautiful. Let's inhale again through the nose, filling the belly up with air, and then exhale, open the mouth and let everything out. Awesome. Take a second here to smile. Everything is okay.